Thank you for taking time out from your beach vacation to present today at the SADS Foundation. Dr. Jennifer White is a longtime patient and parent advocate with SADS. She and her child have long QT, and she works as an emergency room physician with Thomas Jefferson University Hospital in Philly. Jen is taking a break from her beach vacation to talk with us about raising a child with SADS. From many personal experiences. So Jen, I see you've got it queued up. Go ahead. You're ready to go, and welcome.
Thank you. Are you hearing me okay here?
That's good. Yes.
Much background noise. I'm in a hotel right now with our 4 kids out playing by the pool. So
Audio's good.
Audio is good. Great. Okay. Can everyone see my screen and see the appropriate thing on my screen?
Yes.
Yes. Great. Okay. Sorry, I have this thing up here. Closed caption done. All right. So as Marcia stated, I'm Jennifer White. I'm probably a lot of you know me, but maybe you don't. I was diagnosed with long QT type 2 now more than about a decade ago. And I did not have to have a sudden death experience to have that diagnosis, which is very fortunate. I was exercising at a boot camp class and had a sudden unexpected faint, and then kind of sort of diagnosed myself based on a series of treadmill stress tests that didn't look quite right, and then had genetics done, which was long QT type 2. Two of my 4 kids, the 2 boys, were diagnosed as well, and have been thankfully asymptomatic. After I was diagnosed, I was not really tolerating the beta blocker well, and I needed a pacemaker, and I went in for a pacer alone. And the pacer during the EP lab, I had torsades in the EP lab, which again is the absolute best place to ever have torsades. I had to get shocked and then got upgraded to an ICD, and I have a dual chamber ICD. In fact, I have not needed a doctor for the last 7 years. So those of you that are new to this and newly to your devices, thinking this is going to, ruin every aspect of your life, and you're going to be thinking about it 24/7. I have had every complication known that you can have to your ICD, but yet I have needed nothing except a generator change for the last 7 years, and that's coming up in August. And so I'm here to tell you that you are going to be in a good place, and I'm going to give you some tips and tricks to living with your SADS condition, because we are lucky and we're all here for a reason. So I'm also an emergency physician, which maybe makes my take on things a little bit different than everyone else's. I work at Thomas Jefferson Hospital in Philadelphia. I run our Center City Emergency Department. And recently I actually got involved with the World Economic Forum, and I'm essentially the US champion for a initiative on promoting the health of women and girls throughout the globe. So that my career path took a little deviation. You never know where things are going to go. All right, so this is my son, Sam. Now he is now 16 years old. He looks nothing like this anymore, but if you notice, underneath his little shirt, he has his Holter monitor on. Back when they didn't have the little patches that you got to wear, he had to, put all his leads on. He buttoned his shirt up, and we wanted to go out to dinner, and he was embarrassed about it. So he put this mustache on because he said, if I have this mustache on, no one's going to even notice that I have a little thing underneath my shirt. So kids are pretty creative. Don't assume that they're embarrassed by things, or that they don't want to walk out in the world, and let them kind of live life and tell them that it's normal to live life this way. First tip, most important one, which is why I start with it, because you guys might lose your attention by tip number 10. But tip number 1 is, don't panic about finding a doctor immediately. Everyone, let's say you go to emergency room and they see that you have an EKG that may be a borderline prolonged QTC, and you're referred to a general cardiologist, and they immediately want to do things. They get scared of you. It's a rare disease. They want to put you on medications. They want to implant a device. What I'm telling you is that once that train leaves the station, it is hard to back it out. Now, it can happen. And I know, at Mayo Clinic and other specialty centers, they will remove ICDs or implants that were inappropriately placed. But, some of these things cannot easily be reversed, right? So the most important thing, and this is why we're all part of this community, is to find an expert, find the expert early. And obviously you're all here, so you've probably all already done that. But again, don't panic into doing something. Now, if you're in an ICU and you just had, in a life-threatening event, and they're sort of threatening you, you can't leave this hospital without the ICD, then your plan could be to have your local doctors get in touch with a regional or even national specialist to help at least guide your treatment plan. So again, find the right person. And even within this community, there are certain docs that see a lot of Brugada, right? There are certain docs that see a lot of long QT or CPBT. The rarer your condition, and we know which ones are the rarest, right? CPBT and maybe ARVC being the rarer of those, and maybe short QT. You need a doctor that has treated at least a handful, if not more than that, patients with your condition. And again, if you pick a doctor that has not seen this before and is going to be cavalier or cowboy about your treatment plan, and it isn't going well, they will then have a hard time owning those, and I don't want to say they're mistakes, but owning their treatment plan, right? So for example, I was going in for a pacer alone, which again, might not be a terrible treatment strategy for long QT type 2, but I'm getting a lead in my heart. I had, a high risk long QT type 2. I was in my highest risk period. Why wouldn't someone say, do you want a dual chamber device? Even as a physician, I made the mistake of going to my local docs and going down a treatment plan that didn't let me live life to the fullest either. So if you're an athlete, if you're a swimmer, that is even more important to go find someone, because taking away someone's sport is like taking away their life sometimes, particularly if you're an athlete. So find your doctor and find that doctor early. Second, and again, this is a little harder as they get older, but when your kids are younger, get a medical alert bracelet. It gives you peace of mind. It's there for a reason. I tell people to get one that looks like a medical alert bracelet. Lots of kids want these fancy little things that they're marketing as medical alert bracelets. That's just fine. But to those of us that are medical professionals and first responders, right? It's really the first responder that's going to get to your kid who's unconscious, who can't tell that first responder, hey, look, I have a condition, I need an AED, I need this and that, I can't have this. That kid might be with their friends or might be with a different family or your in-laws or whoever. You want that medical alert bracelet to look like a medical alert bracelet. You want it to say simple language, and you want it to be on them that doesn't come off. It can't be too loose, it shouldn't be too tight. One of my kids preferred a necklace that did not last. As you see in the picture, he lost that in about 40 minutes, and they aren't cheap. The bracelet that the younger kid in there has on, that one works a whole lot better. So the school plan, again, a lot of you may be anxious, particularly if you have little ones that are starting kindergarten or going to school with this for the first time. Again, it is if you are well treated and well cared for, it is exceedingly rare for your kid to have an event, at school or anywhere, to be honest. It really is. But what we do, like anything where there's a high risk, right? Even though it's sort of a low possibility, the risk is high, we try to put things and safeguards in place. So that's why we have, lifeguards of the ocean, for example, right? The school action plan, and this is the standard form, SADS has these for you. It should include an up-to-date photo of your child. That is the most important thing. And then meet with the school, figure out where the AEDs are, figure out who has access to them, and importantly, teach the aides on the playground that if your kid is on the ground, they aren't just playing, they don't need some sugar, right? They're always, a kid passes out and what do they assume? Oh, the kid's overheated, or the kid needs to eat, or they're playing. No, our kids might actually need resuscitation, and they should run with the AED. So that's your school action plan form. And notice that we kind of updated it. I noticed that we didn't have anything on there for field trips. And that's something that we could think about adding to this form, but a specific thing for field trips. And we'll have a slide on field trips. Actually, it's next. Okay, so tip 4, you can always go with your kid. If your kid's at the age where they definitely don't want mom or dad to go along with them, then the teacher should know the action plan. They should bring the AED. If the school won't let you take one of theirs on the field trip, which is kind of common, they aren't cheap, then you can bring your home AED with you. I'll talk a little bit about travel. I have traveled, personally, I've traveled the world with this ICD. The only time I had an issue was my very first SADS conference in Columbus, Ohio, of all places. I walk through the metal, or no, I tell them I can't go through the metal detector, right? Because that's what they tell us. And I got wanded by a big giant magnet, which turned, it was magnet mode on my device, and it made the tone alert. It lasted for, 15, 20 seconds. It's what happens when you put a magnet on your device. It was a little disconcerting for me. And I was like, what is that? So just so you know, this whole, and we should probably like change it, globally speaking, but you can walk through the metal detector. Just walk fast. Don't stand in it. Just walk fast through it. It is just fine. But when they pat you down, they use a big giant magnet. And that's a problem at sometimes concerts and events where they're using that big magnet. Don't let them wand over the ICD. Now, if they do it quickly, it should be just fine. But again, it is just fine to travel. Tips for taking the home AED. We went to Maui. I went with my son, that's the curly haired one in the back. He's the older one. And we wanted to island hop. So I tried to take some short flights from island to island. I usually don't check it. So if you check the AED, what they need to do, because obviously it looks like a bomb, they take your suitcase and they identify it as a problem thing, and then your suitcase could potentially not get on your connecting flight, which is annoying, right? And I don't want to be annoyed when I'm traveling. So I put it in the carry-on. I tell them as we're going through security, this is a defibrillator, this is a medical device, and I take it out of its case and I kind of hand it to them and say, what do you want to do with this? And typically they'll run it through and then they'll like do the little, thing to make sure there's no whatever on it, explosive powder. But I have found that it's much easier to put it in the carry-on and explain it to them up front than risk your suitcase not getting on your connecting flight. So again, I've traveled the world, literally the world, and the only time I had an issue was when I did not go through the metal detector, okay? The buddy system, I mean, honestly, it's just a good rule of life. My kids were down at the ocean and my youngest wanted to go swim by herself. I'm like, no, you take somebody with you. So if there's someone with you, and that's Harper, that's the youngest, and Abby, one of her friends from SADS, and that's the family. We're going on a hike. You can notice the gray backpack, that's the AED in it. But go with someone, always have someone next to you, and that person should know, if I faint, this is what you should do. And you don't have to scare them, but tell them what's going on and what could happen. So this one is interesting. And actually I credit this one to Jasmine, who's one of my longtime SADS friends, who a lot of know, long QT type 1, any of the long QT, CPVT, we're always told, right, avoid startle. Well, how on earth do you avoid startle? By definition, startle is when you're not expecting something to happen, right? So it is really silly to try and avoid being startled. To be honest, the times I've been most startled is when I'm running and like a car comes too close, or, someone runs in my path, or, and again, I don't run or bike with noise canceling headphones in for that reason. I actually just listen to my music on my armband, and if people don't want to listen to what I'm listening to, then they can run faster around me, right? So that's one trick. The alarm clock, if it's startling, I think the newer alarm clocks on the phones, they're kind of this chime music, like that isn't quite startling, but they do have some alarm clocks that like, it's like a sun rising, it's light and it makes the room brighter and brighter and brighter. And then you wake up, that might be one. Thunderstorms again in the middle of the night, it is what it is. It's startling. We always put some white noise on in the background so that it's not just this abrupt noise. Fireworks, again, try and decide if your kid is startled by fireworks or not. I know our dog is very startled by fireworks. My kids don't really care, but again, don't live your life trying to avoid startle. It is really, really silly. And this video will tell you that even if you want to avoid startle, Each child is very different. So what startles or scares one of them may not startle or scare the other one. They may love it. So, you know, I'm going to show you this video. It's my number 3 and number 4 on a boat, same trip, same experience. And let's see if this will play. Okay. So one of them is having the time of their lives, and the other is like, get me off of this boat, I might die, right? So again, and this is specifically for, you know, long QT type patients. CPBT is a different story, and I don't want to speak into that because that is clearly a different thing. But again, if you're well cared for, well medicated, and you've had a discussion with your doctor, I think that, you know, if your kid is not startled by things that startle other kids, my kids ski black diamonds, they go on roller coasters, they are just not scared of things. This kid though, this one, he's scared of everything. And he still, to this day, at age 14 is, you know, I'm not going to push him to do anything that he doesn't want to do. So this one is important. I think probably those of you on this call have already figured this one out. You likely know more about your condition than any general doctor you will see. So if you go into an emergency department and you are having a symptom, do not assume, particularly in July when it's all brand newbies, that they know what you need or how not to kill you. And I'm sure you all have millions of stories about the dumb urgent care doc or ER doc, and, you know, giving us a little bit of a break in the ER. We do have to take care of every single patient with every disease, and these are very rare conditions. So forgive us if we don't know everything there is to know about ARVC and CPVT and long QT, but know your meds, know which meds you can and cannot have. Ask, what is that? And then they'll say, oh, that's ondansetron. You're like, I can't have that. Oh, why not? Well, then you can teach them. Look at your, you know, prescriptions that they write for you. You know, it is what it is. People with rare diseases oftentimes know more than their general healthcare providers. The other thing is, have a copy of your EKG. If you go to an ER and they do an EKG and triage, for example, all alarm bells will go off. Now, that could benefit you and that they'll rush you back to a room and you don't have to sit in the waiting room. But Brugada particularly, I have had to stop people from going to the cardiac cath lab with Brugada. Brugada EKGs look just like heart attacks. They look like ST segment elevation heart attacks, and it's usually not, you know, 30, 40-year-olds. The clue is that they have fever and they don't actually have chest pain, but you never know. And I have had to literally say, oh, no, that is not a heart attack. That is Brugada, and they should not go to the cath lab, right? So we could probably talk forever on this one, but have a copy of your EKG with you. Sorry about the background noise. I tried to find a very quiet place. And, you know about your medications, know which medications you can and cannot take. I treated a lady the other day who had a transposition at birth and had, you know, the mustard procedure a long time ago and was visiting. And she would only talk to me because, in quotes, I spoke her language, but she was very much an advocate for her own health. And had, you know, she not said, you know, this isn't the right thing to do, this isn't the right place to go, you know, she could have actually gotten into harm's way. So again, you know yourself, you know your disease. If you don't, then ask your specialist and become the expert. Okay. Again, we're going to continue on the being an expert of your own device. So it's important for you to at least know. I mean, again, guys, this is like $100,000 device with leads inside of your body. You know, you probably know what brand of shoes and what size shoes you wear, right? Why wouldn't you know what brand device you have inside of your body? So know the brand at the very least, and know how many leads you have. I like to help people understand their device report. Again, that might be a little more sophisticated, but at least know sort of what your chest x-ray should look like, where your leads are going. I like the idea of having a magnet. Again, up to you and your doctor, but if you are getting shocked inappropriately because you're, let's say you're out, you know, weed whacking, or you're, you know, using a snowblower or something that could, you know, trigger a shock that isn't appropriate. You don't want to be in the back of an ambulance getting shocked repetitively. That A is not safe, and B is very uncomfortable. So I usually do travel with a magnet, and it's, the big magnet. Medtronic will give it to you. The doctor will give it to you. And again, it's a whole nother talk, but it puts your device on magnet mode, and it is not going to, in quotes, turn off your pacemaker. Okay, that is a myth. It will not do that. So understand what your magnet mode is. And, I tell people, if they feel comfortable with that and their doctor, to carry the magnet, at least when they're traveling. I don't keep it with me all the time. Get the remote device monitor, take it with you for peace of mind, plug it in under the bed, wherever you are. It's pretty small. Those things are constantly surveilling things. The reason I knew I have a Medtronic recall, and that's why, I'm almost at end of battery life, but I will need to get this device changed out, because the remote monitor picked up a recall. So travel with your remote device monitor. This one I kind of touched on a little bit. So this is me during, pretty much every day, all day in our gear, because, COVID is not going away. But don't become a professional patient. You have a life. You have things you want to do, places you want to go. This should not define you. So what will be a problem for you and will cause a lot of stress and anxiety and sleepless nights and depression and lots of things is you becoming a professional patient. What that means is you're constantly online. You're constantly over-interpreting every one of your symptoms. You're worrying if you should put eye drops in your eyes. I mean, it is okay. Some people are incredibly fragile and unfortunately are patients all the time. And for those patients, of course, that is your life. And I am sorry about that. But if that is not you, because most of us, it is not, right? Our hearts, for the most part, are functionally just fine. Live your life. Live your life, right? I tell people all the time, it's like someone with anaphylaxis to bee stings. So if they have their EpiPens on them and the people with them know what could happen, right? Are they gonna never go outside? And then what if a bee gets in the house? So again, it's going to be, if you listen to all those tips and tricks, so that's why this is number 9, right? I didn't start out with this one, but for your sanity, your peace of mind, enjoy life and don't perseverate on your illness. It is not easy to do, particularly in the first year or 2 of being diagnosed. I do get that. Give yourself that. Give yourself 6 to 9 months, maybe a year, particularly if you had an ICU stay. But after that, it is time to say, I am well cared for. I am diagnosed. I'm well treated. And again, I tell people, listen, I have an ICD and a pacemaker. It is very hard to kill me. You're going to have to exsanguinate me, right? I mean, I have both Brady therapy, which means if my heart gets too slow, it is going to be paced. And I have tachytherapy, which means if I have unexpected VT, VF, torsades, I'll get shocked. So honestly, people I'm with, you should worry more about. Don't worry about me. And then the last one is, find your people. This is, what we're here for. This is this community. This is very much a family. Ask your people who have been diagnosed, well cared for, well treated. I mean, Jasmine's already said she's, going to come and get me out of bed in August and tell me to quit whining and having a pity party when I get my generator changed, because, I'm a little bit nervous about being a patient because I haven't been one in 7 years. But have your, know your people, get your people and rely on them. There are some good groups and there are some groups, particularly on Facebook, that, it's kind of always doom and gloom. That isn't healthy for you. It really isn't. Again, the majority of us will be just fine. It's going to be something else that they have that causes them harm, not their device or not their condition. And I'll leave you with this. Life isn't about waiting for the storm to pass. It's about learning to dance in the rain. That's all I got.
Thank you, Jen. That was awesome. And we have a number of questions, 8 of them I see so far, that have some been posted in advance and some have come through while you were speaking. So I'd like to read those and get your responses for our families, okay? Let's see. All right. First one. and you kind of talked some about this already, but what advice would you give parents who have a child that is newly diagnosed?
It really depends on the age of the child. But again, if you are properly diagnosed, you're seen at a specialty center, the child is well managed, it's all the things I just said. Get the medical alert bracelet, get your safety net system in place, get your community, get your doctor, understand who you're supposed to communicate with in the office. I didn't mention that. So for example, Dr. Ackerman's office, it was always Heidi or whoever the nurse was. Know that person, because you can't reach the doctor all the time. Now in the world of like MyChart and Epic Chat and all of that, it's a little easier, but you kind of just are constantly like, can I do this? Can I do that? What about this? You don't want to annoy the heck out of your actual doctor, because they will put you on a short list of people they don't want to call back, right? So you want the nurse or whoever is you're communicating with, and you have a reliable way of communicating with them. And then you tell the closest people who will be engaged with your child in the simplest terms what's wrong and what they might need. And then you decide to just live life. And again, give yourself that probably first 6 months to a year to understand what's going on and let yourself get through it. That's okay. You have to come to reality about this. So that's my advice about newly diagnosed. I hope that answers that.
Thank you. We have another specific one that someone gives the ages of a child a little bit later. So let's see.
Go ahead, Marcia.
Okay, what kind of concerns do you face as a parent for your child?
So again, I mean, do we not all like stand there and watch our newborns breathe and make sure that if they haven't cried at 6 a.m, this does get amplified. I will say, as the kids get older, I still feel worried, but I've tested time in that they've done X, Y, and Z and been just fine. They've gone to camp, they've gone to sleepovers, they've gone to the ocean, they've done all these things, and they have proven that they are fine. You do have to watch them, particularly as they get older, for their compliance with their meds, because again, I feel a little nervous. Is my 16-year-old taking his beta blocker, which is why I am okay with him doing X, Y, and Z. But if he skipped it for 3 days and then he wants to go on a roller coaster somewhere out of state, I'm not okay with that. We've also recently had to add vivants and SSRIs, which I was against for a long time, but they really needed them, and the benefit outweighed the risk. So as a parent, you will never stop worrying about your kid. But again, like I said, if you have the right doctor and they're cared for and they're on the right treatment plan and they're compliant with the treatment plan, then you're going to worry about them no more or no less than any other parent. Now, do I sometimes side with the two kids? And, my husband's always like, why do you have such a soft spot for the boys? I'm like, well, I sometimes worry they won't wake up. So, that I'm not going to tell you that goes away. It doesn't go away, but you live with it. You live with your discomfort, and you don't give it to your kids. Okay. That is what I'm going to tell you. You are an adult. You can handle hard, uncomfortable, difficult things. Do not relay your anxiety or your fears to them, because then they are going to be in this vicious spiral of, can I put sunscreen on? Like, yes, so as an adult, you manage this, you manage it the best you can, but don't convey those anxieties. Give them what they need to know, and make sure they're compliant with their meds without scaring the crap out of them.
Awesome. Okay. How do I broach the subject of long QT with nurseries, clubs, schools?
Yeah, the nurseries at the gym are honestly the hardest, because the turnover at those places are really tricky. Like if you want to bring your kid to like Costco, like childcare, I had a different slide that I took off. We took our kids once to the Bahamas and they were in the kids club. And my kid also has like anaphylaxis to, lots of different, lots of different foods and triggers. And so if he got epi, he would need the AED. So it literally said like allergic to nuts, fish, seafood, milk, dairy, needs an AED. It's not easy. If you're away on vacation, you just have to give them the thing, make sure they have an AED. If your kid is that high risk, then you probably won't be leaving them in the one-off situations. But the routine, like they're going to go to preschool every day, they're going to go somewhere every day, then, you want to make sure that those caregivers have like that sort of school plan and know that. And that honestly, the biggest thing for me is that if they don't have an AED in the place, I do still call ahead to the hotels. Is there an AED? Otherwise, I bring my own and I leave it for them. If they are not CPR trained, you know, you have to make a decision. Is it worth my 30-minute workout? Probably. It's just fine, right? Statistically speaking.
Okay, thank you. At what age would you teach CPR and AED application to a sibling of a child with long QT? And when is it appropriate and responsible to teach the sibling about the potential complications of long QT?
So as young as you think your kid could understand, we at SADS, you know, we teach them, I don't know how old, Marshall, like 4, 5, 6, however they want to learn. And Harper learned at a very young age. Again, you know, is it going to be, they don't need CPR, right? I mean, high quality compressions is great and that needs to happen, but they really need the AED. So what you want to do is teach them how to use the AED that they have in their house. And it's 2 stickers and a button. Right? So everyone should actually know how to do that. Everyone, anywhere. It doesn't matter who you are. And what I tell people is they're more likely to use it on grandpa who's babysitting for the kids than they are on their own siblings. It is not scary. Knowledge is power. So again, don't convey the weird neuroses / anxieties about everything to them, but tell them the important things they need to know. Like if your kid, for example, I think the best example is anaphylaxis. Everyone who is anaphylaxis knows where the EpiPens are, right? And they should probably know how to use them. That will save their life. Same thing.
Okay. All right. How have your feelings and confidence changed over time since you first learned about your child's diagnosis? Do you still think of the situation every day, or has time made it easier? And how do you does it help to talk with other long QT moms?
Oh, sure. Definitely, again, find your people, but it takes time. It's like anything. You have to come to acceptance about things, right? If your kid has autism or ADHD or whatever, you know, diabetes, it's the same thing. Once you feel like you're through the thick of it and, you know, the risk to life isn't as high as it was in the beginning, you get over it. To be honest, it's very funny that like my husband packed the AED for this trip and I totally forgot to pack. I totally forgot about it. I was like, did you remember the AED? He's like, yeah. And we were like well on our way to the airport. And that would have never been something I would have done in the past. So trust me, I mean, again, I'm about 10 years out now. And thankfully I didn't have to have a very scary event. No one had to die for us to figure this out. So it is a different situation when that has happened. And I do respect that, but you will forget about it. There will be way more important things in your kid's life than their you know, inherited channelopathy. I promise you that day will come where you will not think about it.
Okay. Are there any resources on communicating your diagnosis to your children and potentially theirs as well as you navigate genetic testing? I don't want them to live in fear every day of losing a parent or be scared themselves. And her children are 11 and 9 years old. So we'll need some level of detail eventually, but age appropriate.
Yeah. That's what SADS is for. That's why you're here. Honestly. So I think that again, you know, become an expert in your own condition, but it is 9 and 11. That's a perfect age. It's a perfect age to sit down and kind of explain the electricity of the heart. They want to know everything, right? They want to know why the sky is blue. So tell them those things and show them, and then they'll feel power. They'll feel empowered, but don't scare them by it. And again, I think that I always hesitate at these things to be sort of as cavalier as I've lived life, because again, I'm an emergency room physician, so I can probably handle the off chance event that people have maybe better than, you know, someone that isn't medically trained. But it's sort of like anything in life, you know, tell your kid, how do you tell them about their needing to get a reading specialist? Probably the same thing. How do you tell them about their food allergy? Why can't they sit at the table with the other kids who have peanut butter? You're going to tell them they're going to die if they look at someone with some peanut butter? Probably not. But are you going to give them enough fear that they could potentially have a life-threatening reaction? So same thing. Each disease condition is tricky, but kids are knowledge sponges and take advantage of that, particularly at 9 and 11.
Very good. Are there things we can teach young children and or their classmates so that they can help a fellow classmate with long QT in the unfortunate event that they have an episode?
Yeah, so we used to teach at SADS, kind of teach them their elevator pitch. I like that idea. So it's a 60-second, like what you have, what they need to do. So we used to teach them, I have a heart condition. If I faint, if I pass out, whatever word you want to use, don't use the medical jargon, run and get the AED, run and get the teacher, that kind of thing. Just very, very simple. If I look like I'm not responding, if I look spacey, go get the teacher. And then that's what the medical alert bracelet is for, right? So you want different modes of communication for different people. So to the teacher should have the action plan. The medics will have the medical alert bracelet. The doctor should have your medical record, right? But the classmates, it's a need to know. You don't want to make your kid into a freak show, right? That's not what you want to do. And particularly the adolescents are very worried about being different. My kids were very worried about being different. And I left it up to them to tell their classmates. But simple is better.
Okay. What age would you do a drug challenge? I'm a mother of a 9-year-old and 11-year-old girls. We have just had monitoring EKGs for now, but does puberty have any effects on Brugada? And she has type 1 Brugada.
I'm going to defer that question to the experts on Brugada, because every kid, every case is rare and different. Again, if you're thinking about getting an implant, if that's what's making an ICD, that is a big deal. That is a big decision, and that's why you need to go to somebody that's seen a lot of those types of Brugada and make a decision about risk benefit alternative of implanting an ICD, because that's really what the Brugada treatment is, aside from avoiding Brugada drugs.
Okay, you mentioned SSRIs. Familiar with SSRIs? What are vivants? I think is what you said.
Oh, sorry. Vivants is essentially it's an methamphetamine. It's not meth, but it's an amphetamine. It's for ADD. So my kid was essentially failing 10th grade, and I was like, this isn't great. And I brought him to a specialist, and she was like, he scores super high and he could really benefit from this. And we had to, it's a stimulant. So it's really, it's one of those drugs that you have to think carefully about. And I said to him, I think this could help, but only if you take your beta blocker every day. And so once we initiated the Vivants, and every time we go up on the dose, if we need to, he wears a 3-week monitor. And his treating cardiologist right now at CHOP is very conservative. And again, she was just fine with him starting it, but we did have to get that monitor. So Vivants is different medication than an SSRI. An SSRI is a medication we use. There's a whole bunch of them. They're used for depression and anxiety. And that's my other kid. So both long QT kids are on, one of them is on Vivants, the other is on an SSRI. They've been on it for about 6 months now. And yes, I worry. I do, but I think they both really, really, really needed it. So if you're at that point, it is an individualized discussion, and it is not just throw the baby out with the bathwater. These are all bad drugs and will kill your kid. That is not it. Because if your kid gets super depressed and anxious and they can't function, isn't that worse? I mean, your risk of suicide goes up, your OCD risk goes up, right? So again, it's not an easy discussion to have, and one that you should have very carefully and thoughtfully.
Okay, thank you. Does extreme heat trigger events?
Again, so extreme heat, you have to be careful about your electrolytes and your dehydration. And then of course you're worrying like, oh, I'm lightheaded. I go running in the Myrtle Beach heat and I'm like, oh boy, I'm lightheaded, So again, extreme heat isn't probably good for anyone or anything, but as long as you're hydrating and you're, especially if you're on a beta blocker, you're going to have a lot of vasodilation, meaning when you stand up, the blood's going to pool in your legs. And so if you're exercising in extreme heat, that's going to make that effect more. And you probably have more of a risk of a normal faint or a benign faint than you do a rhythmogenic faint, right? It has no really effect on that. But avoiding sort of fever, hyperthermia, which is Brugada and long QT, again, a very sort of sophisticated discussion about those temperature sensitive channelopathies. But heat in general is probably one you just need to be a little more extra cautious with.
Mhm. All right. That concludes our last question, Jen. Thank you very much.
You're welcome. And
You,
I'm getting
you
kicked
could-
out of my space. Apparently they have like a birthday party here. So they gave me like this paper that said, you have a 15-minute warning.
It's time now, right? Well,
It's time,
just
sorry.
in time. Good
And
deal.
you
Now
can
you can
share
go back.
my email address with them. I am absolutely happy to negotiate any of these tricky waters with you. Again, I will defer medical questions that are outside of my wheelhouse. You know, I can't give individualized medical advice, but I am happy to give how to be a parent, how to be a patient with these conditions and be there for you all. So
That's perfect, Jen. Thank you so much.
thanks,
We
guys.
appreciate
I'm gonna-
your talk. And
I'm
now you
gonna
can go
jump
back to
off.
your beach vacation
Thanks,
and your family.
guys. Take care. Good to see
Bye-bye.
everyone.